Okay, so we have Brad here who's suffering from subacromial bursitis. So Brad, what's going to happen is I'm going to use some ultrasound on you today. The idea is to kind of heat the deep tissue, which is your bursa.
Okay.
What the deep heat will do is kind of bring blood flow to the area, decrease some of the inflammation. The ultrasound works, it's going to use sound waves that penetrate all of the superficial tissues.
Okay.
And once the sound waves get down into the tissue, that the motion of those and the vibration, the energy, that's what's going to create the deep heat without actually heating anything on top. You're not going to feel a thing.
Okay.
It may be slight warming. That's okay. Obviously, if it gets too hot or uncomfortable, you just let me know. So just quickly, a couple of things I just got to clear to make sure that it's safe to use this on you. Do you have any history of cancer?
No.
Heart conditions or circulatory conditions?
No.
Do you have any deep vein thrombosis?
No.
Diabetes?
No.
Allergies?
No.
No recent injury to the area?
No.
I'm going to take a look first, make sure that you don't have any swelling or any heat. I don't see any swelling, and he's not hot to the touch. Any previous surgeries on this shoulder at all?
No.
No metal implants, nothing like that?
No.
I don't see any skin infections, scars, cuts, anything like that. So as long as that's all cool with you, do I have your permission to do this?
Yep.
Okay. So first thing I want to do, I would disinfect the area, potentially shave it. What I'm going to do is drape this and tuck it into your shirt to try to keep your shirt nice and clean so we don't get any of the gel on it. Okay, and so here I have a test tube full of hot water,
Okay.
and this one's cold water.
Okay.
So I want you to just turn that way, and I'm going to touch you, and I want you to tell me which one's hot and which one's cold.
Hot. Cold. Hot. Cold.
Perfect. Okay, so now that the area of his arm is clean, while I'm doing this, I'm going to have you just hold your arm like that.
Okay.
In order to pull the structures that I'm targeting out from underneath your shoulder.
Okay.
I've washed my hands. I'm not wearing any jewelry or any rings. So what I'm going to do is set the machine to ultrasound. I'm going to use a 3.3 megahertz frequency because the tissues that I'm targeting are superficial. A 100% duty cycle because he is not in an acute phase. And I'm going to use 7 minutes at a 1.0 watts per centimeter squared in order to get effective heating of the area. So the ultrasound gel. You're comfortable where you're sitting, Brad?
Yep.
Okay. So once, like I said, if anything happens, you let me know if you get feeling comfortable at all.
Okay.
And I'm just going to circle the area, no more than 3 times the size of the ultrasound head for the remainder of the treatment.